Hello, my name is Ben. My paper will conduct about how women of color is greatly affected by mental health and why that is, considering gaps in the government systems are made. For my paper, it will be conducted into three main sections. Section one focusing on how certain barriers of certain barriers of certain barriers women of color face when it comes down to healthcare. That being things like discrimination towards women of color, um, and like bias towards one patient and one professional worker. Lack of trauma informed care. So that means like professionals lacking focus on one's trauma and overall lack of understanding and culture, where there's a kind of disconnect between the patient and the professional healthcare worker because the professional healthcare worker lacks understanding of the patient's background. Section two will focus on how factors that affects one's mental health. In the section, it talks about how ensuring connections being made throughout patients and professionals in order for the patient to reach enlightenment and heal from their past trauma. So ensuring that they aren't there just for help, but to actually build a connection and kind of base it off from there. Um, Understanding the patient's background, so that's understanding their culture, what they've gone through, um, ensuring that they're getting the help they need, and more. Um, for section three, it's about how we can improve in terms of community based programs and certain government policies changing in order for patients to actually, who actually seek the help, get what they need. Um, Certain things like changing of different laws and or policies to get to who gets access and whatnot can play a big factor in how people can build connections and better their lives overall. Um, and also building community-based local programs that can help out local patients and understand one's background even more than professional workers just because they've been around them for so long that they really know who they are. And yeah, overall, that is my paper.